Let's dive into a common surgery and a rare complication that highlights some pretty serious hidden risks.
I mean, we're talking about one of the most successful surgeries out there. They totally change lives. But what happens when one of these routine, successful operations takes a sharp, unexpected turn?
So let's meet our patient. She was coming in for what she hoped would be a life-changing surgery.
And check this out, the surgery to place the implant was a success, took just 110 minutes.
So initially, everything seemed totally perfect. The patient was sent back to her ward to recover.
But yeah, just 2 hours later, the situation took a very, very different turn.
She started complaining of severe pain, numbness, and her leg felt cold to the touch.
And when the doctors checked, it was gone. The pulse in her foot was just gone.
This pointed to one thing: limb ischemia. The blood supply to her leg was completely cut off.
An emergency angiogram confirmed their fears, a total blockage in the common femoral artery. And the culprit was likely a surgical tool that had accidentally damaged the inner artery wall.
So surgeons went in with a stent, a tiny mesh tube, to reopen that artery.
And it worked immediately. Her pulse returned, and 3 months later, she was feeling great.
Okay, so what makes this so interesting is just how rare a complication like this actually is.
Yeah, the chances of a major vessel injury are way less than even 1%.
So how can an artery get injured during surgery? Well, there are a few ways it can happen.
But a big review found that bone cement and excessive stretching are the most common culprits.
Of course, some patients are at higher risk. That's why pre-op assessments are so important.
But the key thing is, surgeons have clear strategies to prevent these exact kinds of problems.
And this whole case really drives home why checking that pulse is so incredibly important.
Which leaves us with a big question. Could better imaging help prevent even these super rare complications?